Assalamu alaikum, everybody. Thank you for joining us for this special edition of COVID Conversations, courtesy of Guidance Hub. Now, here at Guidance Hub, we're not strangers per se to subjects that are related to health and well-being. We've done plenty of things in the past with on topics like organ donation and stress management, obesity, and so on. But today's a very special one because you're not joining us at our centre on Waterloo Road in Cheetham Hill, but you are here with me in my living room. And today we're going to be talking about COVID, and my name is Kiza Jahangir, and I'll be your host, I think, for this evening. Does that make me your host? And I'm here to kind of talk to you today with our special guest, Dr. Bushra Chowdhury, about coronavirus. Now, before we go any further, I'd like to ask you to feel free to comment on our YouTube page, on our live chat that we've got there, and I've got it up and I can see everybody who's there. And share the link and do subscribe to our channel so that you can be notified of anything that we do in the future. And if you've got ideas for subjects that we can kind of talk about in the future, then please do let us know. We'll try and incorporate those. Any questions you have, we'll try and answer them tonight. If you've got interior design suggestions for me, I'm open to those as well. You know, we'll keep things very flexible tonight. So we're joined by Dr. Chowdhury. So, Assalamu alaikum, Dr. Chowdhury, can you hear me?
Walaikum salam, thank you for having me.
Excellent. So, firstly, just tell us a little bit about yourself. You know, I know you're a GP based out of Walkden, but there's probably a lot more to you than that. Why don't you give us a little bit of background?
Sure. Blackburn is my hometown, and I currently live in Manchester with my husband and my 9-month-old baby boy. And I am a busy woman at the moment, trying to juggle work and family and also deal with the pandemic that is sadly inflicting us all around the globe. I'm chair of an organisation called Doctors Worldwide, which is a charity focusing on improving the health around the world in resource poor settings. In countries with resource poor settings. And I'm also a trustee of ASTOC, which is an organisation which focuses on improving the health of the BAME population, which is Black, Asian and minority ethnic groups in the UK, mainly around the northwest of England.
Oh, excellent. So you're super busy indeed. Anyway, never mind during a pandemic. How's the pandemic kind of affected you personally? I mean, I imagine things have changed quite a lot, quite dramatically work-wise.
Yeah, we drastically have to change the way that we work in general practice, moving away from face-to-face consultations and managing as much as we can over the telephone or using video consultations. And it's very different and also quite a scary time for myself and my colleagues who are all working still through this pandemic.
Yeah, I can imagine. So tell us, I mean, I'm sure everybody knows by now, but why don't you give us a little bit of background on COVID-19? I mean, where did it start? What kind of things should people be looking out for if they suspect that they might have it or somebody they know has got it?
Sure. So we know that the coronavirus has been around since it was discovered in 2019, and the outbreak started in Wuhan. I've got a slide on this. I'll bring this up.
Oh, brilliant.
Excuse me. So we know that it's been around in China, in Wuhan, since December 2019, and it has since spread across the globe. And essentially, since January, when we first realized that the coronavirus was traveling at quite a fast rate, it has changed our lives drastically in a short period of time, where we have completely changed the way we live and interact with one another.
Yeah. So, I mean, I've heard, I mean, my background as an ICU pharmacist kind of means that I kind of know what to expect in terms of symptoms. I'm sure you do as well. But for the sake of our viewers that are here tonight and those who might be watching this video later down the line, I guess one of the disclaimers that we can put on some of the advice that we might give tonight is that this is kind of current and up to date as of today, the 17th of April. But I mean, things change very quickly, don't they? What kind of symptoms do we know are very typical of coronavirus?
So we know that the most common symptoms would be namely a dry cough and a fever. And a high fever, usually above 37.8 degrees Celsius, is the UK guidance, and a new cough, and it's a dry cough, so you're not producing any mucus. It's also accompanied by tiredness, and people have reported losing their sense of smell and taste. That's common as well. And if breathing problems do develop, they usually start after approximately 7 days.
Okay, fine. So that's one of the things that really is more of what we would consider a bit of a red flag symptom, isn't it? When it progresses from that more mild disease, which is maybe more to do with kind of a bit of lethargy and maybe just a change in sensory perception in the mouth, to something that kind of quite significantly can affect people's breathing. That's the stage where we would ask people to be perhaps a little bit more vigilant, for maybe a bit more of a downturn in symptoms. Would that be correct to say?
Absolutely. The majority of people will have mild symptoms. And even if they have mild symptoms, it's really important to follow the guidance of isolating from the rest of the people that you live with, and also the whole of the household isolating for 2 weeks from the onset of the first person in the household to develop symptoms. However, if you're not managing at home, you can use the NHS 111 website to go through your symptoms to advise you what to do if you are getting worse. But if you're finding that you are not managing at home and paracetamol isn't helping bring your temperature down, and you are really struggling for your breathing and your breathing rate is very fast and you're struggling, then that would be the time where you should be seeking medical attention.
And that at the first instance is to phone 999, I guess, rather than just rocking up to A&E straight away. They would be triaged over the phone to a degree to make sure that their symptoms are bad enough to necessitate a trip to A&E. Is that correct as well?
That's correct, yes, because it would be inadvisable for you. You wouldn't be able to get somebody to drive you or to get a taxi to A&E. It would need to be a 999 ambulance, and the paramedics need to know that they are dealing with somebody who has coronavirus symptoms, so they can have the appropriate PPE.
Absolutely. Okay, so I mean, some people say that this is kind of a mountain out of a molehill to a certain degree, and they say that this isn't really any different to seasonal influenza. We had 5,000 or 6,000 deaths this flu season from influenza. Is it a mountain out of a molehill? Should we really be as worried as we're being told to be?
I think if you look at the mortality rates comparing the seasonal flu to coronavirus, because the coronavirus is a new virus, we do not have immunity to it, so the mortality rates are higher. And the elderly are more susceptible to both influenza and the coronavirus. However, we find that the mortality rates are a lot higher in the elderly, and also a significant proportion, 1 in 3 of those who are critically ill are from a Black and Asian minority ethnic minority background. So it is disproportionately affecting people from the BAME population.
Yeah, and that's an interesting point you make there, because I mean, this is all very early, and all the analysis and is going to be done, I'm sure, for the many months and years after this time. But at this very early stage, is there any kind of inkling as to why that is so disproportionately affecting people from ethnic minority backgrounds?
We just don't have enough information as to why that's happening, but we think that it's multifactorial. It may be because the majority of people who have poor outcomes with the coronavirus have other medical problems, and those medical problems, such as heart disease, diabetes, and hypertension do tend to affect South Asian and Black people in more numbers compared to the rest of the Caucasian population. Another theory is that it may be caused by a lack of vitamin D. So this is something that maybe is quite simply fixed. There's no harm in taking vitamin D. So if you are able to take vitamin D supplements, then please go ahead and do that, because it wouldn't be harmful compared to a poorer outcome with the coronavirus. However, that's not proven, it's still being studied. And also there may be links with deprivation and also closer living arrangements, and also extended families living together, so passing on the virus between generations in one household.
Yeah, so on that kind of note, you know, you mentioned about social distancing and kind of keeping away from people. How would one socially distance from their own family members if they were to develop symptoms and you're living in a house, and as you say, that people from kind of ethnic minority backgrounds, sometimes there's multiple generations living in a house. That's fantastic in usual circumstances to have that kind of extended support network and all the benefits that brings. But if now one of those people develops symptoms, is it possible to kind of socially distance within, you know, the confines of a house?
Yes, and this is also really important, because the amount of virus you are exposed to is also thought to be why people are doing a lot worse, because they may have repeated exposures to the virus. So if you are poorly, you have symptoms yourself, or somebody in your family has symptoms, it's really important that you keep them separate. They would have to be confined to one room, ideally a room with a window which is well ventilated, and nobody else goes into that room. If you are giving them water or food, you have to leave it outside the door and then walk away, and then let the person take the food. And also that person should use the family bathroom after everybody else has used the bathroom, and it needs to be thoroughly cleaned afterwards, and all the shared areas need to be thoroughly cleaned after use.
Yeah, so I mean, that sounds like it would be very difficult to do, but from everything you're telling us and everything we know about how this virus is spreading within the community, as difficult as that sounds, it's essential, isn't it, really?
It really is, because we're all hearing of family, friends who are affected by this, and we've all heard the stories. We're all saying the prayer when we hear somebody has passed away so many times, several times a day, and it's getting closer and closer. If you've not already been affected by the virus, with somebody you know having it or unfortunately dying from it, it feels like that it's something that is almost an inevitability at the moment.
Yeah, and really we want people to, you know, we don't want it to come home for people before they realize. Unfortunately, I think what as scary as some of this might sound, I think from my perspective, I'd much rather scare people into a level of cautiousness, which means that this virus never arrives at their door, rather than, you know, an element of kind of perhaps being a bit more lax, means that then somebody does have it, and suddenly it can quite easily spiral out of control within a household. And before you know it, unfortunately, sometimes tragic news also arrives with all of that. So, you know, I think certainly those are points that our audience will certainly take home. Now, so we've talked a little bit about the symptoms, we've talked about social distancing and isolation and things. What still is a little bit unclear, I think, from the message that's going out to people is the treatment for coronavirus. Now, there's a lot of mixed messages out there, kind of, and the way that it's treated is different depending on how severe your symptoms are as well. Would you say, you know, what have you anything to add on in that sense?
Sure. So if you have this mild symptoms, namely the cough and fever, you should be able to manage the fever by taking simple paracetamol, and 2 tablets 4 times a day is generally the safe dose in adults who are not having any other medical conditions or on paracetamol already in combination with other medication. So it's really important not to exceed the maximum dose of paracetamol in 24 hours. Plenty of water, it's really important to stay well hydrated, and other things that you must do to make sure that your immune system is able to fight the virus as best as possible. So you need to be as healthy and well as possible. So you need to make sure that you are getting good sleep, you are eating good food which is wholesome and healthy and also nutritious, and you need to be able to stay well hydrated. Those are the simple measures to take if you have the mild symptoms. The cough can be quite difficult to treat. You can try over-the-counter cough syrups, but they are of limited evidence that they actually work. You can try home remedies, things like honey and lemon, and you could try steam to try and help with the dry cough. But usually that will settle down on its own. With regards to the breathing problems, usually it usually gets worse before it gets better, and around day 7 is when the breathing symptoms develop. And then you would notice that your breathing should settle down, and you may feel very, very tired and fatigued. If you're struggling with your breathing and then you feel that you need more help with your breathing, or you have an oxygen saturation probe at home, you can take your oxygen saturations and give that reading to the doctor if you speak to a doctor on the phone, and they can advise you what you need to do next. But normally those readings are above 95 to 100%. If you're struggling with your breathing and you feel that you can't manage at home, and you would then need to arrange to go to hospital via an ambulance. And at that stage, they would give you oxygen. The oxygen may be enough in some people. However, it's a very fine balance between managing with just oxygen through a mask to the stages where if you're struggling, then you may need to be put onto a ventilator. And that's obviously very serious.
Yeah, and that's what we want to avoid as much as possible. And certainly that seems to be the government strategy that we've seen in all the kind of messages and the literature that's been posted around, has been involved in increasing the capacity of those ventilator beds, just so that everybody who does need one then will have access to one. But we don't want it to get to that stage for anybody who's listening up. There's a few comments coming through, a few questions. Let me see if I can read some of these out. So John Cherry asks, can it be present without the symptoms? Can we have asymptomatic people?
Well, some people can have very mild forms of the symptoms. So it may be that you have a very mild cough or a slight cold and you may not realize it, especially in children. Children tend to usually have very mild symptoms. So if you have any symptoms that suggest that you could have the coronavirus, it's really important that you isolate, because it could be endangering the lives of the people that you interact with.
Yeah, and I think the only thing I would add to that is that, I don't know if you remember, these cruise ships that have been floating around, that have been looking for somewhere to dock and so on. I remember reading a few papers where what they essentially were able to do was take these cruise ships and almost treat them as little floating experiments. So they were able to document the numbers of people that were on the ship and their ages and genders and past medical histories, swab everybody, see who did and didn't have symptoms. And one of the interesting figures that came out of that was that about 20 to 25% of people on the ships who had tested positive were asymptomatic. So, and that's bearing in mind the kind of the people who tend to go on cruises are slightly older. And still 25% of those people were asymptomatic, yet so they had no symptoms, but they were carriers for the virus, and so they were still breathing it out. And I think the expectation is that probably it's a little bit higher in the general population, potentially about 30% even. So to Mr. Cherry, I would say kind of, yes, people can be asymptomatic and they can spread it, and that's all the more reason to kind of remain cautious. Let's see if there's anything else. So somebody has put, my main question is that there are a lot of theories around it being all fake. Can you touch on this, please? So this is people who say that it's completely fake and this thing doesn't exist. That's nonsense, right?
I think there's been so many cases now that we all anecdotally know somebody who has had the symptoms and recovered, who can say, I lost my sense of smell, I had a cough, I really struggled with my breathing, I felt terrible for 2 weeks, and I've got better. And then we were also hearing about people who have actually been hospitalized and needed to have oxygen and then been discharged. However, we also know people who have been in hospital and been so poorly, they have not been able to be ventilated and they've passed away and died. And they've not been able to have the burials as they would have done normally. They've not been able to have the big funerals as they have done normally. So, you know, it has had a massive impact into the way that people deal with the dead bodies. It's not overkill. It is dangerous. It is killing thousands of people, and we've had over 2 million cases in the whole world. That's just too many cases to fake.
Yeah.
I just don't think there's any rational argument to say that this is fake.
Yeah, no, absolutely. I'm with you on that. And I think in this kind of climate where kind of pre-COVID, with all the economic kind of the difficulty around funding public services, with every penny being counted and checked before it was allocated to anybody to spend, you know, for us to think now we've got a 4,000 bed unit that's been created in London, we've got a 750 bed unit that's been created in Manchester. You know, my hospital, North Manchester General, we've massively expanded our ICU capacity. All this costs time, money, effort, whilst everything else is being, almost all the other projects that were being planned have been parked on the side, really. And so this has had a huge, huge impact. So I would say to that person as well that, you know, that it's too big to fake, you know, exactly as you put it. So we hear a lot of talk about vaccinations, okay, that potentially might be the way out of all of this. Can you tell us a little bit about the vaccination and how will that change things? When can we expect that to arrive?
Again, it's still very early days. The government announced today that they're allocating a task force to try and develop the vaccine. People all around the globe are working on this because it is a global pandemic affecting so many people. But however, even to get to the phase where we are testing, it is going to be a matter of months before we are able to have a vaccine. And then it will take time to mass produce the vaccine in the volumes that we would need. And then would we be in a position to actually give people the vaccination. So it's going to be a mammoth task and something that's going to take months. So I think we have to be realistic that although we are all hopeful that there will be a breakthrough, that we get a vaccine and it's going to be developed as quick as humanly possible, there are going to be time delays.
Yeah. I think one of the questions, I'm just thinking, there was a question that came through on the Instagram page, actually, just while we're on the subject of kind of immunization. Let me see if I can bring it up. There was somebody who asked about if you tested positive for the virus and then you recovered, does that mean now you've got immunity? So now the lockdown doesn't apply to you to a certain degree? Can they just go out and about and they can go to Tesco and they can ignore the lockdown regulations because they've now got immunity? Is that true?
One would think that that's a logical way to think. However, there is no guarantee that you have actually had the coronavirus because you've not been tested, so it's not been confirmed. And also, the viruses can mutate, so you could be infected with a different strain of the coronavirus. And we think that the virus that we have here in the UK is a much more virulent virus in terms of it's much more aggressive and affecting people in different ways to where it has been affected in different countries. So it may have already mutated once again.
Wow. Okay, fine. So I guess one of the last things to touch on is that, you know, we're part of the Muslim community here in the UK, and that brings its own kind of unique challenges, especially with Ramadan coming up and then the celebrations after Ramadan. So let's start with during Ramadan, let's say. So, you know, we want to have iftar. I really want to, I've not seen my parents very much. I want to go around. My mum's made some rice and she's made some samosas. I can go around and just quickly have a quick bite for iftar, just a 20-minute meal and then run away.
Unfortunately, no. We would all love to be out of lockdown and be able to freely mix with our families. Ramadan is such a blessed month and it's all about family and being around your loved ones. And unfortunately, we are not there yet. It is not safe to mix households. You have to stay in within the family that you live with only. And, you know, going to your parents is putting them under unnecessary risk. It's just not worth the risk because you could essentially be carrying the virus, have no symptoms, and take the virus to the people that you love the most, and they may not survive. It really is a matter of life and death. You cannot mix.
Okay, fine. So you're not going to let me go to my mum's house. What about, can my mum drop me off some food to my house, or somebody gets food and they drop it off to my house? Logistically, is that possible? Can the virus survive on the surface of the dishes? Is there any practical things that, you know, we can do to minimize the risk?
Yeah, I mean, part of Ramadan is sharing with your neighbors, sending food to your neighbors, and this is such a nice thing that most people do partake in. But we have to be really careful. It is advised to not be mixing with households, so just have to think about the practical steps of doing those deliveries. When you deliver some food to a neighbor, it needs to be, you need to knock on the door, step back at least 2 meters and drop the food for the person to pick up and talk from a distance. Gone are the days where you would take one of your own dishes and wait for the person to fill it with something else and you would exchange. You can't do that. In terms of what you are giving the food in, it would be advisable, if you are going to do that, is to put it in a sealable plastic container that you can push closed, and then the person who is receiving it can wash that container before they handle it, and also making sure that when you handle anything, you wash your hands immediately afterwards.
Yeah, I think that's the thing, isn't it? Even if the important thing is, if somebody was to come into contact with coronavirus, as you mentioned on one of your first slides, as long as you wash your hands afterwards, you've taken it off your skin, and now you've minimized that risk as much as possible, even if you did come into contact with it. Fine. So we've got through Ramadan, and we've done our iftars from a socially appropriate distance. What about now? We're at Eid. Okay, so this is now going to be 4 or 5 weeks down the line. Potentially the lockdown restrictions may have been eased to a certain degree. We're still unsure to what degree that may or may not be. Would we be able to even visit family at that point during Eid? Can I do my trip to a dozen houses by 11 a.m.?
At this moment in time, it doesn't seem that that's going to be likely. We're in an extended period of lockdown, another 3 weeks, which will take us into the middle of Ramadan. However, the virus is still going to be out there, and when the lockdown restrictions are lifted, I don't think it's going to be business as usual. We can't go back to the way things were. It took 4 months for the Chinese to get hold of the outbreak in Wuhan. And when they reached that stage where they had no new cases, it was a case where they had drastically changed their lives. They did not have any mixing. They had a very strict lockdown. So the measures that they were observing were way stricter than the ones that we have now. We are still able to leave the house for exercise. We can go to the supermarket. So we are able to do those things. They didn't have those luxuries in Wuhan and still had an extensive outbreak. So I don't feel that is possible, that we will be observing Eid the way we always have.
Okay, so this is going to be a very different Ramadan to what we're used to, but with what sounds like very good reason. Okay, so last couple of questions that we had on our Instagram page. Should you wear a mask when going out? So masks, there's a lot of talk about masks. Okay, should you or shouldn't you wear them? There's different types and so on. What do you think of that?
Sure. Well, the virus is so small it's not visible and it's in the air and it's spread via droplets. So when wearing a mask, you are hopefully trying to keep out particles. So you need to make sure that the mask that you have is appropriate, so the tiniest little particles cannot get through. And also the duration of when the mask that you're wearing, after if a mask, like a surgical mask, gets moist and after an hour, it's useless because it's not able to filter out as effectively. So the type of mask that you wear and what it's for the duration is also important. In certain countries, they have mandated wearing masks. In New York and Czech Republic, everybody has to wear a mask if they're going out and traveling. The Mayor of London, Sadiq Khan, is also campaigning for people in London to be wearing a mask when traveling around London. The UK guidance currently is not to wear a mask. We wear masks at work. However, we know that the masks that we have in general practice are not appropriate to be wearing if we were seeing patients with COVID symptoms. So it depends on what you're wearing the mask for and which type of mask that you need. But currently the UK guidance is not mandated for everybody to wear masks. However, the guidance could change on this, and it would have to be an individual choice of whether you do this or not.
Yeah, it's a very tricky one. I mean, I know that in the meetings that I've been in at work that, you know, the PPE is a very hot topic, and there's a lot of discussion around just kind of making sure that all of the types of PPE that we get for our frontline kind of healthcare professionals is appropriate and it's conserved for them so that they can use it. So I think my only take on it would be that if somebody has got a big box of very, very good masks, take them to your local hospital, because I think they could be put to very good use there rather than just going to Tesco's with them. Okay, one more question somebody's put: is hydroxychloroquine used to treat COVID-19 patients? I guess I could try and comment on this a little bit. So with our patients that we've had on ICU at North Manchester, we've been part of the international trial to see if hydroxychloroquine is doing anything. Basically, does it work? Does it treat any of the symptoms at all? And it's still an ongoing trial, is what I would say to Samina Aslam, who's asked that question. It's still an ongoing trial. There's lots of arms to the trial, so we're comparing hydroxychloroquine to lots of other drugs. There's some antivirals that we're trying to see if they work as well. And essentially the answer is we don't know yet whether it's very good. Now, what we do know about it, because hydroxychloroquine is quite an old drug, is that it's got lots of side effects, and some of the side effects are to do with kind of the way your heart rhythm is, and it can kind of disrupt that heart rhythm quite a lot. So it's not without its risks. So if Samina's got a stash of hydroxychloroquine, or she's able to get hold of some from somewhere, I guess the advice from me to her would be to not take it for now, because it's certainly not proven. And the only thing that's proven about it is how significant the side effects are for now. So we're using it for patients where they've been enrolled in the trial and they're being monitored very closely on a 24-hour basis. You know, we're monitoring all of their vital signs, and we're able to kind of make any corrections if we can, if they need it. But certainly, I don't think anybody from the general public should be touching that and using it. There have been so this is from Nurgis Rahman Salam. There have been some rumors that we can't have antihistamines and anti-inflammatory medication. Could you please clarify what we are and aren't allowed to have, please? So I presume this is the rumors and kind of suggestions that some medicines might be kind of making people more susceptible to catching the disease, and maybe if they do catch the disease, for them to catch the more kind of worse form of it. Is there anything you can share on that?
Yeah, initially there was some concerns around use of anti-inflammatory medication it was advisable to use paracetamol in the first instance to control your fever and any aches and pains you have with the coronavirus. I'm not aware of any guidance to say that you shouldn't take antihistamines. I think because it's hay fever season is upon us, and you'd be fine to treat your symptoms with antihistamines.
Yeah, and I think I'd echo that. There isn't really, it's the information out there is very limited in terms of, there was some suggestion that some particular blood pressure medicines might make people a little bit more sensitive to the virus, but none of that has been proven really. And it's all of the suggestions have either been kind of some kind of mistruths that have been blown out of proportion, or been very, very, very small cohorts of patients with potentially statistically insignificant results as well. So at the moment, the advice is that no, there isn't any medicines that make the disease any worse for people, I think I would say as well. So thank you. I think that brings this evening's session to an end. Thank you, Dr. Chowdhury, for joining us. We hope you can join us in the future for sessions, perhaps post-COVID era, on something or other that's, you know, unrelated. But what I would say to our viewers who are watching this tonight live with us, because the chat box will still be active even after we go off our live stream, is that please comment, let us know, what do you want to see? You know, should we get new guests on? Should we get somebody else on? Do you want to just hear me and a few other people just chit-chatting about general stuff, just to keep your mind off COVID? Now that we've got COVID out of the way, we don't have to talk about that again. Or do you want to hear more? Should we get COVID and the Islamic perspective? Is it a punishment from God, or is it something else? Do we want to talk about that? Do you want to hear that? That's what I'd ask our viewers, and just do let us know. So thank you once again. Thank you to all the viewers at home. Thank you to you, Dr. Chowdhury. We will hopefully see you soon. Thank you.
Inshallah.